All right. Thank you, Mariana. So yes, my name is Michael Odom. I'm an assistant professor in the Department of Urology at Duke University, and I will be moderating your session today. So we're excited to have three speakers from the NIH's National Institute of Diabetes and Digestive and Kidney Diseases who serve as program directors within the Division of Kidney, Urologic, and Hematologic Diseases. They'll be speaking to us today about the pathways to work at the NIH and the opportunities available. We ask that everyone keep their mics muted during the presentations, and we'll have one collective Q&A session following all three of the presentations. If you have any of the quick questions during the presentations, please just type them in the chat or feel free to ask the question directly during the Q&A session. So our first speaker today is Dr. Chris Mullins, who serves as Director of Cell Biology Programs in Urologic and Kidney Diseases. He also serves as project scientist for NIDDK's multidisciplinary approach to the study of chronic pelvic pain research network, and as the director for the KUH Collaborative Grants Program for project grants and resource-related studies. Dr. Mullins also provides oversight for NIDDK initiatives and represents the NIDDK on multiple NIH working groups. He is certainly known amongst most of us in the CAIRIBU community, and we're happy to have you with us here today. Thank you, Dr. Mullins.
Well, thank you, Michael. What a nice introduction. Yes, today I'll be speaking on NIH as a career path for urology investigators, and I'll be joined by two of my colleagues here at the NIDDK, Dr. Danny Gossett and Dr. Jenna Norton, and we'll each provide information on pathways for employment at the NIH and provide our individual perspectives on our own unique journeys that got us here to this position. So I'll begin with a little background on the National Institutes of Health to get us started. The NIH mission is a very broad mission to seek fundamental knowledge about the nature and behavior of living systems and to apply that knowledge to enhance health and lengthen life and reduce illness. And just FYI, the NIH's, in terms of the NIH's budget, the NIH is the world's largest source of medical research funding with an annual budget of almost $48 billion. 83% of this money is awarded for extramural research, meaning grants to the competitive grants to research institutions, to researchers, medical schools in every state across the United States. And 11% supports projects conducted by the 6,000 scientists in its own laboratories on the NIH campus in Bethesda, Maryland. And there's a few percent for construction and maintenance and a few things like that. So obviously, the NIH is a very big place. It is comprised of at least 27 institutes and centers, plus a variety of offices, all under the NIH Office of the Director. And the NIDDK, where we work, is just one of these institutes and centers within the NIH. So one small but important part of the entire very big enterprise. When considering employment for scientific or research related careers, it's really important at the offset to really understand the difference between the extramural and the intramural programs. And these two programs are really the major components of most institutes at the NIH. So in a very simplified slide here for the intramural programs, the intramural research program, or IRP, represents the internal research program at the NIH, and it's the largest biomedical research institution on Earth. There are approximately 1,200 principal investigators and more than 4,000 postdocs that conduct a wide variety, of course, of basic translational and clinical research. And its unique funding environment means that the IRP can facilitate opportunities to conduct both long-term and high-impact science that would otherwise be very difficult to undertake at academic institutions or in industry. And on the NIH campus, there are over 50 buildings devoted to this research enterprise, as well as the NIH's 240-bed research hospital, which is devoted primarily to clinical research protocols. So this is the intramural or internal research program of the NIH. So the extramural program, which is where we work, is the other half or the other part of the work conducted at the NIH and the various institutes. This is represents the extramural programs represent the largest public funder of biomedical research in the world. And through the extramural programs, the NIH provides financial assistance for projects that advances its mission in a variety of broad research and research-related categories. And I've listed a few there from the website. And again, around 83% or so of the NIH's budget goes toward the extramural grants programs. So here's a closer look and also a simplified look at the NIDDK's extramural scientific divisions. Within the NIDDK, we have 3 of these extramural divisions, each with their own mission interests. The Division of Diabetes, Endocrinology, and Metabolic Diseases, the Division of Digestive Diseases and Nutrition, and the Division of Kidney, Urologic, and Hematologic Diseases, where we work. Within the KUH division, we have the non-cancer urology programs, which cover a wide variety of disorders, all from benign prostatic hyperplasia, incontinence, chronic pelvic pain, repair and regeneration, and all sorts of normal and abnormal lower urinary tract development and physiology efforts. And again, non-cancer urologic disorders. So now with that very brief introduction of the NIH and putting it into some perspective specifically about the NIDDK extramural programs, I'll switch gears just a little bit and describe a few major on-ramps to identify and apply for NIH positions, whether it be the intramural or the extramural program or both. First of all, I'll start with the intramural research program homepage. And again, this is just for intramural research positions in the research enterprise conducted on the NIH campus or other research facilities across the United States. Here on this homepage, you can go directly to careers, and when you go to careers, you can identify faculty level scientific career opportunities, other science and clinical careers, general recruitments and administrative careers. And if you specifically click here, faculty level scientific careers, it takes you to a listing of various open faculty level positions, director level positions, etc., where you can click and get additional information. These are usually targeted to one particular NIH institution or center. And within those various sites for each of these jobs, you can learn all about the job and what it entails, review when the reviews of applications begin, when the job closes, et cetera, et cetera. Also, the NIH Offices of Human Resource homepage is a great source for information. This site provides diverse information about working at the NIH. Here you can click jobs at the NIH for searchable job categories, including internship programs for students and recent grads and application tips. And of course, it's not just for scientific jobs, it's for all manner of jobs at the NIH to keep the entire thing running, if you will. And here you can sign up for the NIH Jobs newsletter, in which you can be alerted when certain types of jobs are posted and become available. Another terrific site, which is really a very traditional workhorse for searching and applying for government jobs, is usajobs.gov. At this homepage, you can search for diverse jobs across the entire federal government, not just the Department of Health and Human Services and the National Institutes of Health, but across the entire federal government. This site also contains lots of how-to information about the federal government hiring process, which is probably different than most of you may be familiar with from your other positions. And it's great to first create your USA Jobs profile, because this will be very useful if you begin to apply for jobs, because you can use that profile again and again and again, and it saves you a lot of time in applying for various jobs. And again, here you can identify and learn details for specific jobs and apply. And this is important because generally, this is the site used for actually applying for a position. And believe me, it's a lot easier to do that than it used to be. And when looking at the NIH for urology relevant positions, it's very important to remember that urology research is a shared interest among numerous NIH institutes and programs, not just the NIDDK. Here, if you look, for example, of urology research projects across NIH institutes, you'll see that the two major players are really the NIDDK for non-cancer urologic research, but also the NCI for more cancer-directed urologic research, but a number of different institutes also, NIID and NIBIB and NIA and NICHD, among a few. And if you look at a few examples of very common urologic disorders that I know are very well represented within CAIRIBU, for example, such as bladder infection, that's an interest that's shared between the NIDDK, NIID, and a number of other institutes. Urinary incontinence is shared between the NIDDK and NICHD and a number of different institutes. Prostate cancer, primarily NCI. Prostate enlargement, though, could go to NIA or NIDDK. So the point here being that whether it be for intramural or extramural positions at the NIH, there are a lot of places to check besides simply the NIDDK or the NCI. And along these lines, also remember that all research interests are welcome and needed in urologic research. You don't have to be a urologist or from a traditional urology training or research background for a career in urologic disease research or administration at the NIH. And as everyone is certainly beginning to appreciate, that understanding and developing treatments for urologic diseases require a multidisciplinary approach. And this means a collaboration among diverse scientific backgrounds, whether it be mathematics, molecular biology, public health, neurobiology, sociology, engineering, all manner of clinical medicine, all of which really can work together to understand and develop treatments for urologic disorders. So even if you don't come from a traditional background, it's still worth looking at toward the NIDDK or the NCI, other institutes for careers in urology research or administration. So now I'll finish up with just a few, for my portion, just a few slides that detail a bit my career path to the NIDDK. It's a reasonably straightforward path. I received a bachelor's degree and a master's degree from the University of Louisville, then a PhD in microbiology and immunology from Vanderbilt University, performed a National Research Council or NRC associateship at the NICHD here at the NIH. And I came out of all that with interests in training and expertise in a wide variety of basic science, biochemistry, molecular biology, genetic models, organelle biology, protein sorting, et cetera, et cetera. So a career path that a lot of PhDs might take. So, then the question was, now what for the longer term? And this is a question that a lot of us face, of course, when we're toward the end of our training period. Well, unlike a lot of my friends at the time, I wasn't really sold on the traditional next step, if you will, of competing for academic faculty positions. So I investigated to various degrees, industry and teaching positions, patent law, science writing. I thought about more training and more training and more training. Sort of in my mind, it was like, where does this end? And also, because it's local, I also looked at opportunities on Capitol Hill. But through all of this searching and through these opportunities, I became interested in health science administration at the NIH. And as for timelines, for me at least, and again, I put a caveat here that this was a long time ago, back in 2000 and 2002. So things have probably changed somewhat since then, but this is my personal path. I started out about a year and a half or so before I knew that I really needed to make a career move. I did broad review of career options, career websites. I spoke to peers and my boss and went to career seminars, really casting a pretty wide net. And then about 12 months out, 6 to 12 months, I started to focus my research for the specifics of several selected options. At this point, I did a lot of information gathering and visits and discussions with individuals who had those positions, such as program officers and others at the NIH. And it was very convenient, of course, that I was already here. And through various contacts and people that I had worked with, I got to know a number of program officers and visited them and talked about the job and became more and more interested in that. Then I entered an application phase, which was about 4 to 6 months out, which was pretty late for the federal government. And these days, it's really quite late for the federal government because the hiring process can take a long time. There, I looked at formal advertisements, mostly usajobs.gov at that point, and I also sent unsolicited packets to key people in places. That was back in the day where you might assemble a lot of information in a big fat envelope and put some stamps on it and mail it. I know it's done a lot differently these days, of course, and this could be an electronic approach, obviously through email or other forum. But I didn't just rely on the formal advertisements. I also tried to reach out to divisions and institutes and centers and individuals and send them information about me because you never know when some place is about to open up a position, or they might even develop a position if they find somebody who's a very good fit. So that an interview phase several months out, this was primarily at this point NIH health scientist administrative positions. I found that some positions were not a good fit. For me personally, a scientific review officer role, that's a wonderful job. But for me, that wasn't such a good fit. Better fits included program, which is what I do now, of course. And I became very interested in those jobs through the interview phase. And of course, as I put here, luck can always play a part. In the current, my KUH division here at the NIDDK, back when I was hired in 2002, my then division director had just read an article or two of mine that I had recently published about organelle biogenesis and lysosomal dynamics, and she was interested in incorporating more basic science into the urology and the kidney programs at that point. So it was very fortuitous for me, and that helped me get the position here as an NIDDK program director for cell biology of urologic and kidney disease. I'll begin to end with some final and very obvious advice to do your homework and prepare. Of course, start early, much more than a year before you plan to leave your current position, especially if you're interested in the federal government. Make contacts and ask for advice. Know the job before you apply and don't be shy. This really helped me understand that this would be a good fit for me and realize that people really like to talk about what they do. So, you reach out and you contact someone and you say, I'd like to talk about your job. I'm interested in this. I think most of the time you'll really get a willing person on the other end of the line. Reach out to agencies and institutes, even if a position is not currently posted. You never know what expertise they may be considering. And this is really, really true. You might not think you might not have worked in cancer biology, but you see an opening at the NCI that you really like. Don't be shy about applying for it or reaching out to the division that might be posting the position, because you never know what kind of expertise they might be looking for then or in the future. So that's very important. Don't limit yourself to those opportunities that you feel that to only those that you feel that you're just a perfect fit for. And don't apply for a job or a position or internship that you don't want, or you'll get it. It's very important to be happy in what you do. So don't just apply for everything. Be focused in your applications. And I have to say it, prepare for the interview and be ready to explain why you want the position. That seems like a given, but it's very important to prepare and to come to a table, especially for a job like program that we do, which is somewhat non-traditional, I guess, for people coming out of their training. You really want to be able to explain why you like that position and want that position, as opposed to going on to practice or academic research or whatever the sort of traditional route might be. That's a question that I always ask people when I interview them. And finally, play to your strengths. Do some soul searching and think what you like to do and what you're good at, and play toward those strengths in jobs that you're looking for. And also look for a position that will make you fulfilled and proud. And I know it sounds hokey, but I'm very proud to work for the NIH and for the mission that I serve here. And that's really an important part of your job, to do something that you think is really important. And I would say working for the NIH is really top on your list for that. So I'll leave you with a listing here of the primarily the program officers in the urology programs, which includes, of course, my colleagues, Dr. Danny Gossett and Jenna Norton, that you'll be hearing from now. Feel free to contact us. We've each had our own unique journey to go from where we were to where we are now. And again, I think anybody on this list would certainly be happy in speaking to any of you about your career choices, or to give you whatever advice we can. So, Michael, I believe you said we'd have questions at the end. So if that's true, with that, I'll stop then and hand it over to, I believe Danny is next.
Yes, and so would you like me to introduce Dr. Gossett?
Yeah, please.
Okay, great. So please welcome our next speaker, Dr. Daniel Gossett. Dr. Gossett serves as a program officer for the NIDDK Rebuilding a Kidney Consortium, which focuses on, as the name implies, stimulating productive kidney repair and regeneration in vivo, as well as generating functional kidney disease tissue ex vivo while for transplantation. He is also a project scientist for NIDDK Kidney Precision Medicine Project. Along with serving on other NIH working groups, Dr. Gossett's portfolio includes biomedical imaging of the kidney, technology development efforts, and translational research in the areas of kidney, urologic, and hematological diseases, including research conducted by small business. Dr. Gossett, thank you for joining us today.
Thank you, Michael. I'll jump in. That was a great introduction. Uh, so, sorry, let me just move a couple things out of the way here. All right. Through the presentation, I'll walk through a few of the steps on my career path from an undergraduate studies in material science and engineering at Johns Hopkins to graduate school in a biomedical engineering interdepartmental program at UCLA to launching a startup and applying for SBIR small business grants to a presidential management fellowship program, and then conversion into a program officer position at the NIDDK. So I'll really skip over undergraduate and start with graduate school and postdoc, though throughout my training I was really interested in developing technical skills and then applying those to address unmet needs in biomedicine. So at UCLA, I started by studying physical phenomena that occur in microfluidic channels when particles, such as cells, are flowing at really high speeds. I later developed several devices that harness those phenomena to manipulate, for example, to sort and analyze cells, particularly measuring biophysical properties of single cells. And I was an inventor on a handful of patents related to those devices. Wanting to translate these benchtop experimental devices into useful clinical or research tools, a few colleagues of mine from UCLA and a few other institutions launched a startup, and we applied for SBIR grants that I'll touch on briefly. These are grants to small businesses to conduct research and development that has the potential for commercialization. My startup's first SBIR was from the National Science Foundation, but I'll take this opportunity to discuss the NIH Small Business Program as I coordinate those programs for the NIDDK. So as Dr. Mullins already stated, the NIH mission, it can be summarized as turning discoveries into health, and the small business programs help get innovations into the hands of the patients, clinicians, caregivers, and researchers that need them. These are congressionally mandated programs that are set aside from the NIH R&D budget that Dr. Mullins outlined. These grants are always made first to a small business, though as you can see from my example, the invention may have arisen in an academic lab, and then the company is created to help translate and commercialize those inventions into products. SBIR and STTR outlined here are really highly interrelated, similar programs. They both can involve collaboration with non-for-profit research partners. For example, if there's a subcontract back to an academic lab where the invention arose. And I won't get into the details of this program today, but you can find a wealth of information on it on the NIH SEED website, seed.nih.gov. This cartoon shows how companies are often formed to help translate biomedical basic research discoveries that may have been supported by other research grants like R01s. That discovery, though, may have also occurred at the small business or somewhere else. The NIH small business programs are one of the largest sources of early stage capital for life sciences in the US. There are also other sources that are equipped to support companies at various stages of development. But one of the benefits of the NIH funding, the SBIR funding, is that it's non-dilutive. We don't take any ownership of the company. It's also not a loan, so you don't need to pay it back. And the impact for us is that the commercialization of these technologies can have a positive impact on people's health. Many companies are also early stage, and our awardees can therefore leverage the NIH funding to attract the partners and investors that will be needed to take the innovation to market, particularly to fund some of the more expensive later stage activities. So a couple years into working at the startup, due to both family and professional reasons, I applied to become a presidential management fellow. This is a leadership development program for advanced degree holders across all academic disciplines, so advanced degrees, PhDs, JDs, MBAs. For this program, you apply to be selected as a finalist, and then finalists have 12 months to secure appointment as a fellow, which is a 2-year full-time paid fellowship at a federal agency. In addition to working at a single federal agency, you may have the option to participate in a rotational opportunity at another agency. There's 80 hours of formal interactive training and development each year of the fellowship. And one of the strong benefits of PMF in particular is that an agency may non-competitively convert a fellow who's met the program requirements to a term or permanent position in the competitive service. So in my case, I was hired by the NIDDK to assist in the management of the small business programs, as well as to work within the Division of Kidney, Urologic, and Hematologic Diseases. Luck certainly did play a part. I interviewed at a few ICs, and as Chris alluded to, sent some cold emails to other federal agencies. But really, it was essential to find an IC or institute or center that not only was there mutual interest, but they have an open position. Some other important notes: this is generally not a laboratory fellowship, though I did rotate. Completed my rotation for 4 months in a division of one of the institutes at NIH, the National Center for Advancing Translational Sciences, formerly in their intramural research program, though it was a branch that was focused on partnering with extramural research labs to develop new drugs. In my 2 years at NIDDK, I completed various analysis projects, collaborated in the organization of several scientific workshops, assisted in administering the SBIR program across the NIDDK, interacted with applicants and grantees, and gradually built a small portfolio of grants under my management. PMF is but one of many internship and fellowship programs across the federal government. I've listed a couple here: Presidential Innovation Fellows, the Oak Ridge Institute for Science and Education, or ORISE, the AAAS fellowship, your institution's career center is likely to have a list or database of these and can help you determine what is active, what you're eligible for, and what might best align with your career goals. I will touch a little bit more just on one of these, the AAAS program, which is a common pathway for PhDs at NIH. So the NIH partners with the AAAS to place fellows for 1 or 2 year periods at one of the institutes and centers within the NIH. The fellowships provide the opportunity for scientists and engineers to learn about policymaking while contributing their knowledge and analytical skills. Like PMF, it's not a laboratory fellowship. Each year, NIH sponsors up to 40 fellows, and the fellows are, during the 2-year program, 1 to 2 year program, are classified as temporary federal employees, but you're eligible for most federal benefits. And while they're not automatically converted to permanent employment at the end of the fellowship, they are encouraged to apply for qualifying federal positions. And I'll also note that this is a program that is available across the federal government, not just NIH, and not just the executive branch. So completing the requirements of the PMF and finding mutual interest with NIDDK to continue here, I was converted to a permanent position as a program officer. Sometimes you'll hear it called the program director position. The job series for this is typically the health science administrator series. And these are some of the typical responsibilities at a high level. We listen to the needs of the clinical and research community and propose research and training initiatives that address challenges and opportunities. We write notices of funding opportunities, or NOFOs. We provide guidance to investigators pre and post award, both to those responding to the funding opportunities we issue, or more frequently to the majority of applicants that are responding to parent announcements or submitting so-called unsolicited applications. We monitor the programmatic, scientific, and technical aspects of a grant. We work in partnership with grants management staff on post-award administration, including review of progress reports. And you can find more information about the role, as well as other related roles, such as the scientific review officer role, at the link in the bottom left. One of the tools that NIH has to help advance our mission is the ability to convene scientific workshops to bring people together. Here are a few examples over the past few years, workshops that I've had some role in. These scientific meetings can have multiple goals. They may be information gathering for gaps and opportunities. They may lead to development of a concept that could eventually become a notice of funding opportunity, but that's never a given. And often these are to help a community or communities by bringing them together, bringing in new perspectives, highlighting new research tools or resources, potentially seeding collaborations, and having them discuss how to overcome common challenges. I'll provide one quick example of an initiative on kidney precision medicine. A little background, although acute kidney injury and chronic kidney disease impose significant global health burden, there are no current therapies for acute kidney injury and only a few for chronic kidney disease. Both of these have historically been described as single uniform diseases, but there's growing consensus that they're interrelated and that different disease pathways lead to different subgroups of acute kidney injury and chronic kidney disease. Access to human kidney biopsies from people living with these diseases is a critical step to define the heterogeneity and determine the precise molecular pathways that will facilitate identifying specific drug targets and ultimately enabling individualized care for people. Another key motivation was that recent advances in multi-scale interrogation of human tissue and single cells were becoming available. And the objectives of the program that we launched were to overcome some of these hurdles and take advantage of the emerging opportunities these technologies presented. So the goals were to ethically obtain human kidney biopsies from people with acute kidney injury or chronic kidney disease, diseases where a biopsy is not commonly obtained, create a kidney tissue atlas using various cutting-edge imaging and omics methods that at the time had not significantly been deployed in kidney research, define disease subgroups, identify critical cells, pathways, and targets for novel therapies, research that's generally not hypothesis-driven. In summary, there were several significant challenges to overcome that were unlikely to be addressed by individual research project grants, and only by getting many labs, clinicians, patients with disparate expertise to work together could this be achieved. And so NIDDK issued several related funding opportunities to establish a consortium specifically designed to advance kidney precision medicine. The project is about 7 years in, and there's a lot of data available. If you're interested in using it to generate your own hypotheses or to support your own research, please visit the kidneyprecisionmedicine.org website. And I'll turn it over to Dr. Norton.
Thank you so much, Dr. Gossett. So our last speaker for today is Dr. Jenna Norton. Within her role as NIDDK Program Officer, Dr. Norton's work focuses on efforts to implement health equity research with a special emphasis on the role of social determinants play in kidney and urologic health and disease, as well as racial, ethnic, and socioeconomic disparities. Dr. Norton also supports work relating to advancing health information technology and data standards in kidney research and care in order to improve interoperability of data and research efficiency to ultimately improve patient outcomes. She co-leads the Electronic Care Plan for People with Multiple Chronic Conditions project and serves on multiple NIH committees and work groups. Please welcome Dr. Norton.
Are you guys seeing the right side of my screen now?
Perfect.
Okay, thank you. So thank you for that introduction. I think part of the reason maybe why I'm here is to show you that not every program officer at NIDDK comes up sort of the more traditional pathway. When I was putting my slide together, went and looked for the curviest path I could find on Google Images and came up with this one. So I started with a bachelor's degree in food science and human nutrition, not really knowing what I wanted to be, I think, when I grew up. I did a service year with AmeriCorps at Alachua County Reads, where I got exposed, to a lot of different things. And, a lot of the kids that I worked with there had incarcerated parents, just came from a very different walk of life. And so I think that was a very formative experience for me. I went on to get my master in public health and environmental and occupational health at GW, and then landed a health communication internship program with the President's Cancer Panel, which also was a really formative step for me because I had an opportunity to work there on a report on America's demographic and cultural transformation implications for cancer, which sounds like the most boring report ever written, but it was actually quite interesting, I think, particularly for its time. This was, back in the early 2000s, and the report really focused on race as a social construct and the need to move away from a biological view of race, which I think at that time was not prominent in the medical field. And so I think that was also a very formative experience for me. I went on and did more health communications work on NIDDK related projects for the National Diabetes Education Program and then the National Kidney Disease Education Program, actually working at large communications firms. And through those roles, actually got engaged with this guy here, Andy Narva, who was a program officer at NIDDK and retired a few years ago. And when my firm Ogilvy lost the National Kidney Disease Education Program contract, he convinced me to take a job as a contractor within NIDDK. And so I worked for, I think, a largely sort of made up program kind of continuing some of the activities we'd been doing under the National Kidney Disease Education Program. So we called it the National Kidney and Urologic Science Translation Program. And during that time, I had a lot of opportunities to engage more in science. I worked with Dr. Narva and Dr. Kimmel, Dr. Starr, Dr. Rogers, several other folks here at NIDDK, and really started getting into the research around social determinants of racial disparities in chronic kidney disease. Through that work and with the encouragement of Dr. Narva and others at NIDDK, I actually went back to school, got my PhD. And so I also want to call out my PhD mentor here, Dr. Kolmas, who, was a fantastic mentor. She, when I first went in and said, here's what I want to do an ancillary study to CRIC, which is a large cohort study we have on the kidney side at NIDDK. And she was like, you can do all that after you get your PhD. Right now, just get your PhD. And she hooked me up with existing data that she had, really allowed me to get my PhD much more quickly than I think I would have with my original ideas. And so just want to acknowledge her contribution to my career path. I then, once I got my PhD, became a health specialist with NIDDK, and then eventually a program officer. So definitely not the traditional path, but here I am. I made it nonetheless. And so a few things that I think I learned along the way. So just good mentors are critical. I think we all know that. But we say that a lot, but really, what is a good mentor? And just a reminder that good mentors will pass you opportunities. They will give you full credit for your work, and they will help you find pragmatic solutions so that you can advance your career. If you're interested in science, in someone's science, ask for an informational interview. Chris touched on this as well, but people like to talk about their own science. I personally made a lot of connections and acquired a lot of opportunities by just cold emailing people and saying, hey, this was fascinating. Can we sit down? Can we get a cup of coffee? And I've also had people reach out to me that way who I've been able to, help move their careers forward as well. And so I think it's a really good approach to make connections, get to know people, find opportunities. Another thing I would say is be open to opportunities that present themselves. I think that a lot of the things I ended up doing, I never had thought about in advance. And so sometimes opportunities present themselves in ways that you don't expect, and will lead you in directions that can be really helpful. Another thing I would say is don't be afraid to shift directions if you find something you're passionate about. I think the way our system is designed is it assumes most people know what they want to be when they're 18. And I don't think that's the case for most people. So, if you get halfway through and you think, you know what, this isn't really what I wanted to do, or this isn't what I thought it was going to be, that I think I'm a testament to the fact that you can shift directions and still make it somewhere in the end. And do find something you're passionate about, because, work is hard work. And if you're doing, 45, 50, 60 hours of work a week, and I wish that's not how our field was, but, it often amounts to that. It's got to be something that you are passionate about. Otherwise, you will burn out. So, and then the other thing that I would just really emphasize is that outside perspectives are critical and often the most important. So if you're the only voice in a room saying something, keep saying it, because a lot of times it needs to be said. I also want to just acknowledge again briefly that, there are different types of jobs at NIH as you're thinking about career opportunities here. So you've heard a lot today from program officers like Chris and Danny and me. We administer grant portfolios, we propose scientific initiatives, we convene workshops, we advocate for scientific areas, and then do a lot of other things too. But I do just want to reiterate that there are other positions within NIH, and Chris and Danny touched on these as well. But just since you're hearing, I guess, in this panel mostly from program officers, just want to acknowledge that scientific review officers is another position. For example, they ensure that scientific review groups identify the most meritorious science for funding, refer applications to the right study section, find and recruit reviewers, assign applications, administer the review, and they write summary statements. And then, of course, there's the intramural branch, where we have research scientists who work in, bench labs, do clinical research, do epi research. across a variety of topics. So I also want to emphasize, what I love about being a program officer, because I think it is a role that affords a lot of opportunity. So you get to help people along their scientific career paths. So, you really get to give guidance and give back to the community and help people find, the best opportunity that matches their scientific ideas and give them guidance. You get to advance exciting research ideas. So, putting forward initiatives, convening workshops, you really have this opportunity to kind of advocate for and shine a spotlight on areas that have been underappreciated or underrecognized. You get to participate in research still through cooperative agreements. So I think a lot of people fear that by becoming a program officer, you kind of become divorced from the science, but I feel still very involved in science, although I guess I didn't really come from a traditional scientific background. So, at least from my perspective, I feel like I get to do a fair bit of science. And I will just say, working here at NIH, of all the different places I've worked, and I've worked at many, I work with some of the smartest and most passionate people that I've had a chance to work with. So I really appreciate all the people here, within NIDDK, but within many other institutes here at NIH. Lastly, I just wanted to highlight one more potential path. I know we're getting close on time. There's this Pathways program for students and recent graduates. Some of you may be past this level, but I still want to acknowledge it as it may be relevant to a few of you out there. So Danny already talked about this third box, the Presidential Management Fellows, but I also do want to acknowledge that there are also pathway fellowship opportunities for students and recent graduates. Aside from the PMF program, you basically, the purpose of these programs is to recruit highly motivated and talented individuals to fill entry-level positions. It ranges, all the way from associate's degree all the way up to PhD, and they include both scientific administration as well as research careers through these. And there's a link at the bottom if you want to check those out. I mentioned cold calling earlier, or cold emailing in this case, but one of the people who works at NIDDK as a Pathways Fellow now, she's in the current student line, reached out to us with a cold email saying she was interested in the work we did, and she was able to come on through this Pathways program. So just another testament to the fact that, just sending out those emails is a good way to go. And so that's all I have. I'll stop there. And I think we have a little bit of time for questions.